think we're good now. Okay, if anyone is on, everyone please comment so we can continue. So I think we lost you right when you started talking about the Sonic Mini.
Okay. So Sonic Mini is a similar device. And like I was talking about, Joel, what do you refer to that term as, the movement of the head in and out? I call that travel. What do you call that?
Wow, you just lost me. I'll come back at you in a minute.
Okay. So what I've noticed with the Sonic Mini is it's about a 1/2 inch of movement, and I'm not sure how well the camera shows that.
Okay. Yes, it's the stroke length.
Stroke length. And that sounds much more technical. That's good. I like that. But the stroke length is larger on this one, but 5 levels, I feel like, I don't know. I think there's a tendency, most people that I interact with that have or have used massage guns have a tendency to want to turn up the heat and to want to go to those levels 3, 4, and 5 and to really create a lot of effect on the tissue. But what's interesting is if you understand what's taking place in your nervous system, there's actually quite a bit of value for the very low-level intensities when it comes to calming pain and decreasing muscle tension, right? A quick anatomy lesson for you. Are you ready? Joel, is that okay if I give an anatomy lesson?
Go for it.
I'll keep it G-rated. So imagine every muscle has an origin and an insertion. So it has 2 ends, and along the length of that muscle, when a muscle contracts, it causes that muscle to shorten. There is multiple reasons that will cause a muscle to contract. Voluntary muscle contraction, obviously if we're choosing to lift or to grab or to push or to pull, we can obviously turn muscles on voluntarily. But there's also involuntary muscle contractions, and the 2 most common there are, one is called hypertonicity. So hyper is too much, and tone, there's too much tone in the muscle. So imagine a dimmer switch on a light going from like a 0 to a 10 intensity. You can dim the lights, and they're not all the way off, but they're definitely not as strong as they normally would be. Now, hypertonicity, when people say, I carry my stress in my shoulders, or things like I've got a back injury and my back is very tight, that tone is a result of a couple different things. One could be a protective mechanism from the body, but oftentimes there are receptors that live inside that muscle belly that tell the body what a resting length can and should be. When there's an injury, it's very common to have, or excessive muscle soreness, it's common to have the dimmer switch at like a 2 or a 3. So the muscle never actually turns all the way off. This is what causes a lot of people fatigue, exhaustion, and this also increases pain. That low-grade contraction of the muscle is being determined by these receptors. Now, those of you who want to look them up, the 2 primary receptors, one is called a Golgi tendon organ. Those live in your tendons, and they measure length. Oftentimes, the people refer to them as GTOs. The other one is called a muscle spindle, and the muscle spindle lives vertically inside the muscle fiber. So as the muscle flattens out as it's pulled, there's compression on that muscle spindle, and those signals, the muscle spindle and the GTO, they both send signals to the brain telling us what is normal, what is safe. If you've ever been in a position where something is stretched too far and people kind of get really anxious about it, that's those Golgi tendon organs and those muscle spindles saying, hey, the tissue's not going to tolerate any more than that, or there's going to be failure or damage. When there is repetitive trauma or there's an injury to a tissue, that resting tone of 2 or 3 out of 10 is that hypertonicity is something that's very adverse to the tissue actually healing. I'm not sure how much detail we want, but as the nerve connects to the muscle, there's neurotransmitters that get stuck in that space. One is acetylcholine, and that can cause a muscle to remain guarded and stiff. Now, if you understand that is the problem, then you understand how to use a tool to counteract that. A percussion or massage gun is extremely effective because the moment that you apply that repetitive length change to the muscle, and so imagine that muscle, those Golgi tendon organs are being pumped full of information, short, long, short, long, short, long, literally with a massage gun, you can change the length of that tissue thousands of times a minute. There is so much information being pushed through the nervous system that those muscles will begin to, we call it down regulation. They will begin to almost melt away, and that guarding will go away. That 2 out of 10 will allow the muscle to release and to drop to a full relaxation, and that will allow tissue to calm itself. And that's an incredible thing. I'm amazed that 10 and 15 years ago, a tool like this was very uncommon, especially not in this caliber. It didn't exist. And so now that we have a tool that can create an effect on muscle tissue and on the nervous system, these are things that could have never happened 15 and 20 years ago. You see, videos of a massage therapist doing the percussion with their hands. Now, is that helpful? Yeah, they're manipulating the nervous system to cause those muscles to relax. This is a massage therapist's hands with a speed that would never be able to achieve by a human. It wouldn't be possible. So right. Just a phenomenal thing, and one that we can be extremely grateful for, and two, that we can cause these effects to our nervous system to help break some of these bad nervous system habits and give people a break in pain, to stimulate an increase in blood flow for recovery, and to pump out cellular debris in the process of people that are suffering from inflammation and swelling.
Awesome. So what would you say the top 3 benefits that you use it for your clients or patients? Like, what is it like? Why do you use this?
Oh, absolutely. So a common phrase you hear people say, and I mentioned it earlier, some people say, I carry my stress in my shoulders, meaning that there's a lot of low-grade hypertonicity. And that's an interesting thing, that for the neck and shoulders, where our posture is, whether you're a receptionist, a businessman, a mechanic, an athlete, people that are having large loads over long durations of the day, to be able to reset the nervous system at the end of the day, I'd say that's an extremely effective thing. People who have whiplash from car accidents, extremely effective. The next thing I would say is probably most effective is people with low back pain. Generally, this is a large generalization, but a lot of people with low back pain will suffer from very tight hips. And so to apply the massage gun around the hip musculature to get it to relax and to begin having more efficient stretching, a lot of times we'll take a lot of load off of the spine and people will have less pain. So I would say the 2 of those are the most common. And then the third that I really like is once you start getting into the smaller and more specific attachments, stabilizing muscles of the extremities. People that suffer from tendonitis in your forearm, people that have compressive or overuse injuries like runners in their calves and ankles, extremely effective to get onto a small tissue with a very specific precision tool can provide great effects. So that's what I love.
So going back to your second benefit about lower back pain, how would you recommend, let's say I walk into you and I say, Brad, I have massive pain. And you're like, hey, grab this Dynamini, and what do I do? So I just put it on my lower back on the highest level.
That's a great question.
This one?
So for low back tissue, obviously the muscles of your hips and your back are some of the largest in the body. I will generally use, for me personally, I don't know if I mentioned it in this when talking to you guys, but the metal attachments I find are extremely effective over fabric. And what that does is, moving on top of fabric, you don't have any, what we refer to as shear force. There's no gripping from side to side. When you're working on your low back, you don't want a lot of shear force between the tissue, but to have that smooth and rhythmic movement, and as whoever's using it, whether it's a medical provider, a massage therapist, or you're doing it for yourself, or a loved one even, as you move that around, you want it to be very smooth and very therapeutic. And so using the metal or the plastic attachments that glide on fabric, I really like. I mentioned the speeds. I think people are very tempted to generally go to the very high speeds, but if you turn on any of the massage guns and you go to that very first level, you'll see that there's a lot more slow movement there that can be very calming to the nervous system. I think people don't use it as quickly because they don't feel the effects right away. But try and experiment. next time you've got a tight muscle or you've got something that's irritated, put that on there at the lowest level for 1 minute and compare it to the outcomes that you feel on the highest level after 1 minute. And I think you'll notice that if you're suffering from very tight muscles and it's something that if it's stress driven, if it's posture driven, you spend a lot of time in the car, things like that, the level 1 is actually extremely therapeutic for longer durations at lower intensities. And that's one of the things that I like. The higher intensities definitely have value. If you're preparing for activity, if you're going to exercise, there's definitely things for upregulation of the nervous system that they're very beneficial for. But I tell people, most people, every nervous system is a little bit different. The things that your body is accustomed to is extremely unique to your behaviors throughout your life. And so there's really not a hard and fast rule. The duration and the intensity, I think, is very self-explanatory. But I think some people ignore the lowest levels for the long durations. And I think you'll actually find that it does create a great effect for calming some of your symptoms.
I have to agree. You know, one of the most common questions we get on emails is, which is the most powerful gun? And, you know, it's not everybody needs the most powerful gun. You know, you always start at the first level. So let me ask you, so who do you think these guns are good for? Because you mentioned earlier that you specialize with firefighters and golfers and police force. So do you think it is best for them, or anybody can find use?
And I love the tool because it is extremely versatile, right? If you suffer from tightness, from pain, it's interesting. Muscle contraction is muscle contraction. We have firefighters that they can pick up 600 pounds and they can carry people out of a building, and they're extremely well trained. I had a guy come in 10 minutes before we started our podcast, and he said, "Hey, I got to get one of those," because he's had treatment with it. And he says, "This is extremely valuable and it helps me so much. I want to do it at home." So he's great. And then you have other people that come in, and we have patients that have multiple sclerosis and Parkinson's disease, different types of, nervous system malfunctions, if you will. And to put a gun on somebody who's learning to walk and learning to balance, it can upregulate the nervous system just as effectively as it's trying to downregulate on somebody who's very high performing. So I don't think you can discriminate. It's just making sure that you know what you're doing and for what purpose. So yeah, it's very, very versatile.
Awesome. So we have a few questions.
Yeah.
Let's go through a few questions. Let me swap the screen here. Okay. First question. Do you see the comment on the screen?
I can.
So Lay is asking, what about using the percussion for nerve damage or atrophy?
And that's a very interesting one. Nerve damage, there's a very large umbrella of types of nerve damage. Some people have experienced crush injuries. Other people have compression of discs and nerves in their back. Right.
It's a very general question. I agree.
Super common. Generally, someone who has nerve damage, like even a common one's neuropathy in your feet, a loss of sensation. If you're using it specifically for nerve damage, I'd say the most effective component is that upregulation. We talked about how much information is being pumped into the nervous system. As a medical provider, I have to be a little bit careful because we can't just say, oh, everybody should use it for nerve damage. But if you're suffering from muscles that are extremely tense, that can be a result of the damage of the nerve that contracts the muscle. It can be very effective. Other people suffer from nerve damage that causes shooting pain. Something to be very well aware of there is, what is the origin of that pain? Sometimes people have numbness and tingling in their hand, and it's the result of a compression of the nerve in their neck. And they think they have carpal tunnel, but in reality, they've got a compression in the cervical spine. So I think making sure that you, as much as you can, there's lots of good information out there.
Okay, I'll tell you the answer.
Yeah, let's hear it.
You need to visit Brad. So if you're local, first get it diagnosed and make sure you get it right, because you don't want to do the wrong thing, right? You don't want to mess up and then massage some, a different, you want to make sure that you're getting it right. So that's for sure. And I'm sure you can diagnose right now over the Facebook Live, but I guess the point is at first figuring out where the issue is stemming from, right? Am I a point?
Exactly. And I've had people that have come to me that have never seen medical attention for an orthopedic injury, and they're frustrated with their massage gun or with, some tool or device or piece of exercise equipment, and they're like, it's not working, or it's making it worse. And it's because they're treating their symptoms and not their problem. So just beware that you're getting good medical advice. There is wonderful information out there. Again, Joel, I don't know if this is something that's possible to post, but we are very involved in the community. We're in this profession not because we want to make, 7-figure incomes. That's not an option, but we want to really help people. So if people want to ever call our clinic or have a conversation over the phone, we do lots of Zoom and live. I had a niece that plays college soccer in Virginia, and we were on the phone yesterday, and I'm diagnosing her for a soccer injury that she suffered this week. And so there's lots of things that we can offer people. If they want to reach out, we'd be more than happy to chat with anybody who would like a little bit of direction.
Yeah, for sure. I'll definitely post your information. So let's go to the next question. Is Lay asked the second question. So oil or moisturizer would be good as well. I'm guessing she's asking if you can apply oil or moisturizer to the tip of the gun.
Absolutely. And I would think that there'd be a couple different ways to do that. Generally, when I'm going to use a tool, whether it's cupping, people talk about myofascial release with a tool, or some people call it scraping, or with a massage gun. I'll generally apply lubricant to the skin to decrease, like we talked about, shear force is not always the most calming to the connective tissue. So being able to put that device on there and create a side-to-side movement without any friction, it's very effective. But at the same time, using the foam ball, you can create a lot of friction. And so depending on what you're trying to achieve, you can manipulate that tissue in a way that it can create friction, which can be equally valuable in the right setting.
Is there a specific massage head, or do you find that any of them work? Meaning, do you specifically recommend the metal one?
Yeah, definitely a metal or a plastic tip if you're going to be using some sort of massage cream or some sort of lubrication on the skin. That's one that you definitely want to make sure you've got the metal or the plastic tip.
All right. Okay. Awesome. So now we have, this one. Facebook user. I don't know who it is, so please mention your name. But what is the best for fibromyalgia on tender points on pain?
That's a very good question. Again, I'd go back to the response, start at the very lowest levels. And the most forgiving tissue is the largest tissue. So I would start, depending on where your pain is, even if it's not directly at the site of your pain, sometimes there's a term that we use called the novel stimulus. Sometimes your body just needs something new. So to apply a percussion gun in an area that's not part of your injury, say you have pretty severe back pain, to begin in the large muscle groups of your thighs and your hips, and to work progressively closer to the site of your injury and pain is actually a very effective tool or technique to get there without having to really exacerbate any symptoms or to risk. I'm sure this individual knows there's lots of things that are intended to help that can make things worse. So just being large muscle groups, starting away from the site of the trauma and working toward your pain, and always just moving slowly. Your body will always signal to you and allow you to know that there's something wrong before you'll do damage if you move slowly.
Beautiful. So I got from you that I should go slow and start from a larger muscle group like my thigh or my lower back or my chest, right?
Absolutely.
And then move into the smaller muscle groups in my arm. I'm trying to see myself on the camera. So which head? Any massage head or any of the massage heads?
The most forgiving. So, and like I said, you've added this new little attachment here. This is very forgiving. The foam definitely gives a little bit of forgiveness, and I would say a lot of people, and I say this a lot in my practice, trust your instincts. You know your body. When you open this thing up, you're going to look at one and say, "Ooh, I think I'm going to like that one." Trust that. That's okay. And everybody's a little bit different. So just know that your instincts, this doesn't need to be a science experiment, but experiment with different things, but definitely begin with what you think of your gut is probably the best thing to do.
Excellent. Beautiful. Any other questions? Anyone has any other questions? Meanwhile, I'm going to remind everyone that we have a code for today, 15% off all the massage from Brad15. until 11:59 p.m. tonight. I'm posting it in the comments and the link to. And here's a good thing. We actually made the coupon code automatically apply. So you just have to, and if you click the link, it'll automatically apply. That's what it means. You don't have to copy the link. You don't have to copy the coupon code. Okay, so I think we don't have any other questions. Do you have any closing thoughts? Anything that you think that would be that one thing? Oh, wait, we got a question.
Okay. Rotator cuff.
I have rotator cuff issues, and I find that after I use my sonic, I tend to feel good at the time, but the next day I'm sore. It's not showing up the entire question.
Yeah, that's it's an interesting, I mean, our bodies are very much, it's a machine, and there are laws that determine how our body responds to each system responds differently to different stimulus. It's hard. I tell people when they come in for physical therapy, sometimes it's really hard. If you're working with a personal trainer and a physical therapist, a massage therapist, and a chiropractor, and there's a lot of people that are working in the kitchen together, sometimes if the recipe doesn't come out just right, you're like, well, I'm not sure what it was. You know, I've done all these different things. So sometimes there's value in simplifying the number of things that you introduce at a specific time. So a rotator cuff issue that causes pain the next day, sometimes it's hard because you may have taken out the trash the day before, and in reality, it's the trash that causes symptoms and not the massage gun. And I'm not saying that it's not the massage gun, but as much as you can, take all the different factors that stimulate changes in your symptoms and isolate them. And if you can do that to the point where you can say, okay, I've tried, you know, if I stretch and use my massage gun, I feel better. How do you know which one it is? You need to isolate. And then once you've isolated whatever it is that seems to make the difference, then begin with dosage. Sometimes too much of a good medication can be a bad outcome. And we refer to that as overdosing. You can overdose exercise, you can overdose stretching, you can overdose a massage gun. So I guess what I would say is start at the lowest intensities, try and take away all the other surrounding factors, and do a short duration and do a low intensity, and see how you feel the next day. And if you're still sore the next day, then maybe the dosage, the tissue's just not ready for a percussion massage. And that's a very realistic thing. But maybe you start there and you say, hey, you know what, I can do it for 2 minutes, and I can do it at a low intensity, and I feel really good the next day. And over the course of 3 days, 5 days, 7 days, you can begin to increase your dosage and say, hey, I actually feel a lot better. I can now tolerate 5 minutes. I can now do 2 minutes twice a day, or whatever the dosage may be. But in rehab, we refer to frequency, the intensity, and the duration of intervention. And take all of those down to the very lowest levels and begin with that and see if you still have symptoms. But I would definitely begin with those things.
Yeah, no, 100, that's a very important point. 2 points you brought out. Number one is don't do, you gotta, like you said, you gotta do one change at a time. And if you do too many, you really can't diagnose it. It's like with us on our website, on our website, we'll test 10 different things, and, you have to test one thing at a time.
Yep.
Make sure that this works and then move to the next one. Otherwise, you don't know what the issue is. So, Betsy, let's close out with one more question. Betsy is asking about carpal tunnel. She has numbness on her wrist after prolonged computer use. I guess her question is, how can she use the gun to improve?
Carpal tunnel, just a quick explanation. Carpal tunnel, there's a piece of connective tissue that looks a bit like a bridge that covers from the inside of the wrist to the outside of the wrist. There are 3 major nerves that come down the hand, and they pass some under and some over that tunnel. Depending on the symptoms that you have, if it is the primary fingers, then you're barking up the right tree with carpal tunnel. Some people come in and they say, hey, it's my outside 2 fingers. That nerve doesn't run through the carpal tunnel. So making sure that you have a correct diagnosis is very important first. If you do have carpal tunnel, there are lots of things that you can do that can help that compressive force on the tissue. What's interesting is moving again away from the site of your trauma and working the muscles of the forearm, posture muscles of the neck and the chest and the shoulders. You'd be surprised. I have people all the time that come in with nerve compression injuries, and we never just focus on one thing. We want to look at the big picture solution, and maybe the computer problem may be partly postural. That's a very common thing. I know it is for me. But to be kind of crouched down and collapsed, and then the wrists are going to be compressed on top of that. Some people would say, okay, well, I need to fix my wrists, and they work just in that very specific area. But I would make sure that with your massage gun, working upstream through the forearm, through the bicep and tricep, and all the way up into the chest and shoulders is very, very important. So there are a couple other interventions that are very effective in addition to a compression or in addition to a massage gun. But with the gun itself, I'd make sure that you just work upstream. Those nerves initiate at the neck, out of the vertebrae. They turn into a large complex through the shoulder. And then as they exit, they turn into 3 specific nerves down that arm and into the hands. So just making sure that if you can make that whole span from basically the central nervous system, your spinal cord, all the way to your fingertips, the more pliable and free you can make that entire complex, the better you're going to feel. So again, work on the big picture.
Beautiful. That was very good. That was awesome. And it's, I forgot what I wanted to say, but yeah, don't forget about the ergonomics, right? You got to make sure you got the right chair, you got the right desk. And otherwise you're doing 8 hours of terrible posture, and then you're wondering why you have pain. So I hope, Betsy, I hope that was yes. She says thank you, and someone else says thank you. Look at that. And then we have Lay. Lay says you're very knowledgeable about the human body. I appreciate your time, tips, and expertise. So Brad, thank you so much for your time. And of course, if anyone has any other questions, we can forward it to Brad, and I'll post his information if you want to visit him or if you need a consultation with him. So thank you again, Dr. Brad.
Well, and you guys come out to Arizona anytime. We'd love to have you. The weather's about to get beautiful out here.
Yes. I'm going to be jealous in just a few weeks.
Yep.
All right. Have a great day. Thank you, Brad.
Thank you.
Take care. Bye.